Hi, my name's Kevin, and I'm going to be talking about my heart-related problems that happened to me last year, and I'm also going to be talking about the support that I had from the Louth Cardiac Rehabilitation team. It was in 2012, January of last year. I travelled up to Leeds on business, and I stayed in a Premier Inn overnight. I arrived there about 8 o'clock. Feeling a little bit tired. I'd had my tea with my wife before I'd left, and I remember texting her at about a few minutes after I'd got there, and said to her basically I was feeling more tired than usual and that I needed to go to bed. So probably about 9:15 I went to bed and slept until about 2 a.m. Unfortunately, I woke up then not feeling too well. I thought I'd got a virus coming. I had symptoms of feeling sick but couldn't be sick. I also was hot and cold and feeling generally not well. And I tried to get back to sleep. It didn't really happen. And I stayed up. Shortly after that, decided to ring down to reception and ask for an ambulance. I got ferried off to Leeds General Infirmary, went through A&E. After that, I got assessed, and shortly after that, again put on a full ECG monitor and established I was having a heart attack. They took me down into one of the theatres, and they suggested putting a camera up into my heart through my leg, which they did, and discovered really there was a serious problem with blockages in some of my arteries. They suggested, because of my relatively young age, that I should have heart bypass surgery. When I came out of theatre, obviously I woke up in intensive care, and my wife was at my bedside holding my hand, which was really nice. I was then told what I'd actually had as an operation, and I'd actually had a quadruple heart bypass. So you can probably imagine the shock. I knew probably it's going to be several months before I ever returned to a bit of normality. When we arrived home, it was a difficult period. My emotions were all over the place because you felt a little bit as if you was on your own, and I was looking for the support that I think not just myself but my wife needed at the time as well. And whilst we was in Leeds General, they had suggested that we contact the local cardiac rehabilitation support programme who are situated in Louth, and we prompted that by calling our local GP surgery. They gave us a number and we called them and got through to them more or less straight away, and I must say they were absolutely brilliant. Not just for me, the support was there also for my wife, and the nurse specialist came on the visit, and she was absolutely fantastic. She gave me the support that I needed. They did certain checks like monitoring my heart rate. They did blood pressure checks, and also looked at my lifestyle. And we talked about medication, even giving me leaflets from the British Heart Foundation, which I found was really fantastic. In terms of looking at the Louth Cardiac team and my view on them, they really do stand out as a professional outfit. Right from the start, the support was there on the telephone. I had the initial nurse specialist visit and set out different things that I needed as a patient to aid my recovery programme, right through to the exercise programme that I had, and following that through all the things that they supported us with on the programme. And another really important part of their service was that either before the session or after the session, we always had some person come in and talk about different areas, if you like. It could be about medication, it could be about dietary, it could be about lifestyle, how to get motivated in terms of physical activity outside of the centre there. And the level of confidence that the support programme has given me has helped me boost that. Consider now I'm doing probably between 10 to 12 miles a week walking. So I do that over 3 sessions. I swim regularly. I eat the right food. I stick to my diet 95% of the time, if you like. I do have the occasional treats, I must admit that. But my physical well-being is much, much better. I'd put on 3 stone in weight prior to my surgery. I've now lost the 3 stone. So in actual fact that cost me a lot of money thinking about it, because I had to dump a lot of my clothes, so actually it cost me a fortune to replenish the stocks, as they say. But yeah, I feel an awful lot better. But certainly the support programme within Louth has helped me achieve that, and along with the support of my family, my wife obviously, and friends as well. To pick 3 words to describe Louth Cardiac support team, I'd certainly, the one I would use would be very professional, right along the way, fantastic. The second word I would use as well is confidence. They've given me the confidence to re-establish my life, but not just re-establish, but to actually improve my situation. And the third one is an interesting word, but education, because I think education is really important to the facts of what's gone on and what's happened to me, because I was shocked at the time that it happened, and I think a lot of other people would be in similar situations. But if you don't have the right education behind you in terms of, you know, looking at your lifestyle, the medication that you're on, the dietary requirements, then yeah, no, I think that's really important. The message that I would give to the Louth Cardiac Support Team, firstly, would be a big thanks, and I would say it's a really important part of the NHS, and long may it continue. If I was to give any advice to anybody that went through the problems I had, would be to certainly contact the Louth Cardiac Support Centre as soon as possible, because I think once that initial call's made, or the referral or whatever, it sets in place or sets in motion a very vital part of your recovery programme. The experience I had right from the start to finish has been one of excellent care, professionalism. I couldn't have asked or wished for anything more than they gave me, and you know, a big thanks to them.